them. So
right. Well, good morning, everybody. I'm excited to be here with you today. Spent a little time thinking about neuro, and actually we've been doing a lot of neuro stuff. Today we are meeting with some vestibular specialists. We are getting ready to build a bunch of vestibular sims that will basically outline the clinical practice guidelines for vestibular hypofunction. So my vision actually for this next generation of learning is partly about creating resources that help faculty to do their job better without having to reinvent the wheel. So that's one piece that you'll see today. And the other part is, have we missed an opportunity to meet this generation of learners where they are at? They want to play. They want to play in low risk environments and play until they know. And so I think there's this great opportunity for us as faculty to collaborate and to envision the future of what it means to help students be exposed to material or apply material that they've learned instead of deliver and test, deliver and test. I think there's something missing in that mechanism. So I'm happy to share a little bit about all of this and kind of get your thoughts. So let me start with just saying that one of my dearest friends, Kathy Kumagai Shimamura, passed away. Man, it's probably been over a year now. She was the neuro instructor in our class, in our program. She was a bright star in this world, a very happy, brilliant person. She's an OCS, NCS, mentored in all the fellowships in Southern California. And one day she said to me, "Hey, Mikey, that's not fair that ortho gets all the good videos and all the good apps. I have this binder that's like 3 inches thick, full of neuro examination procedures. Even I fall asleep looking at them. Could we film an app that covers all of the techniques that we would need to teach that generally fall in the neuro toolbox? Or really, there will be more techniques here than you probably have time to teach. So I'm going to show you the NeuroExam and Neuro Simulations. If we have time, I'd like to give you a glimpse at the new task analysis app. So we did it, and we use it regularly in our program. And as you heard, for those of you who joined earlier, there are many faculty, I think, who find that it's useful to have this as not only a backup, but actually as a precursor to lab. So the question we were trying to ask was, how do I introduce neuro examination procedures in an efficient and clinically relevant manner? Is it efficient? And this is just an open-ended question to all of you. Is it efficient to try to show all the neuro techniques that day in lab? Can students learn at that pace? Does it sink in deep? Is that the most efficient use of our limited lab time? Those are all the same questions I think we all face who teach in these types of labs. We never have enough time. We always have too many techniques. So could a well-organized library help to organize these things in the student's mind? And could they be a precursor to coming to lab? And this is one of the things that I'm suggesting. When you have access to these video linked lab handouts, so I'm going to take you directly into the app. I'm going to go right over here. So when you log in, we'll pull this down here. And by the way, gang, feel free to just chat any comments or questions, or stop me at any moment. This is a perfect time for us to always just have conversation. When you log in, so at PhysioU, every faculty member has full faculty access. That means as a faculty member, myself, and a number of faculty members who have built these apps, we have decided to support our colleagues and provide it for free to all faculty. So you can use it no matter what and illustrate things in your classroom. So when I sign in, you will see that there's this whole cluster of apps, and in purple, a huge collection of e-learning content, interactive simulations, interactive micro-learning type games. I will show you what they're like. I'll run you through one of them. To find the neuro content, we've decided to help you sort it. So you can see it sorted right here. When you go into the app itself, you will see that we have organized all of the examination procedures I'm going to close this sidebar for now. All of these procedures for you to teach. So my guesstimation, and we built this based on, I always tell the authors, let's think about how most faculty teach neuro, and let's organize these apps to make it most useful for faculty and students to learn from. So you can see in motor control, we have selective movement testing, we have upright motor control, we have coordination testing. So let me just give you an example. Rachel, who is the other author, was the lead for the neuro residency at Casa Colina, which is a neuro specialty rehab, essentially like a hospital with a number of different settings, outpatient, transitional care. So she does a brief introduction of this particular test. So let's just take a quick look.
The upright motor control test is a functional strength assessment designed for individuals with upper motor neuron lesions, such as a stroke or a brain injury. Consider using this test on a patient who has impaired motor control or lacks selective movement. The upright motor control test assesses flexion and extension strength at the hip, knee, and ankle.
So the students can watch this all, pre-watch this all before coming to class, and then you have all the different techniques demonstrated by her, the purpose, the setup, the patient position, therapist position, the cues, and the grading, as well as the references. If you go on to, for example, sensation, you have protective sensation and functional sensation, pinprick, temperature. Here's functional sensation, touch, 10 test, cortical, polyneuropathy, mononeuropathy, vibration, 2-point discrimination, right? You can see this whole collection here. All of it, again, can be easily linked into your handouts, and I'll show you how to do that. So let me actually go over to tone just to show you real quick. Here is spasticity assessment, modified Ashworth, and her performing the entire modified Ashworth. Let me just pause for a second. Is there something that someone wants to see or ask for a second before I move on?
Chat is clear.
Okay, sounds good. Selective movement testing, Fuglemeyer, sideline synergy test, all of it has been filmed. So if I go back to, let me go to actually jump to coordination.
To assess for dystidocockinesia, have your patient seated with both hands on their lap, palms facing down. Instruct your patient to rapidly alternate palms up and palms down on both hands. As they do this, assess to make sure both hands are moving together. Another way you can assess dystidocockinesia is by starting with one palm facing up and one palm facing down. Instruct your patient to alternate the position of their hands. As they do this, make sure that both their hands are moving opposite of the other. Assess coordination with finger tapping. Instruct your patient to tap their fingers repeatedly, starting with their 5th digit to their thumb. This can be assessed unilaterally or bilaterally.
So if you were, for example, in balance, and we took 5 times sit to stand, what happens in our program is when it comes to balance week, the students have a lab handout that they can go to. So let me show you how to get to that. There's a sidebar here, and there are these complementary resources. So if you go under educator resources, this is essentially at our website, and you go to teaching content, you'll see lab handouts. And if there are any classes that we think are very predictable in the way that the labs are taught, we built lab handouts for you. These are either PDFs or they are Word docs that you can modify. So for example, if I go to balance and I go to the PhysioU NeuroExam Balance, this is what the Balance Lab Handout looks like. The instructions that match the app, the grade score, and then a direct link to the actual video. So your students, our call to action for the students is before you come to lab, you need to watch all the techniques once before you come to class. Because when we come to class, we will go over them again. In some cases, we can actually start going into lab because all of you have the app already. I just kind of talk about a number of techniques, demonstrate a few key ones, and then the rest, everyone take their apps, time to practice. The other nice thing about this is it buys you as faculty an opportunity to take a breath, take a breather. Anytime you want to pull up a technique, you have PhysioU already up and running. You pull up any particular technique you want. So let's say I go to stroke or spinal cord injury, Asia. Here is motor, and you have the motor exam for Asia all laid out for you. You don't have to do all of them if you don't want to, or the students have already looked at it. Okay, here's dermatomes, light touch. This is just a minor thing. We'll remove that in a second. I think we've been making some little edits here and there. Here is vestibular, the oculomotor exam. Let's take a look at smooth pursuits.
Keep your head still and follow my fingers with your eyes. Assess slow eye movements. Watch for any abnormal eye movements, such as nystagmus or disconjugate gaze. Abnormal smooth pursuit is a sign of a central vestibular disorder.
Now, the other thing that I want to show you, so like I mentioned before, these lab handouts are all built and available for you for the entire NeuroExam app. You don't have to build a thing. You just go ahead, download the lab handout. So let's say you download the Word document. I'm going to download that. And then you can edit it and then put it into your LMS, and the students have a fully flushed out lab handout with videos hyperlinked already. So there it is. You can do whatever you want with it. So again, we're trying to create decreased load for faculty, efficiency of learning, and really leverage the videos that are available. One other way that I think is very useful for faculty to see is if you're in the app itself. So let's say we're here at Smooth Pursuits. You can see that there's this little sidebar. In the sidebar, there is a faculty-only resource. First, I will point you to the new curricular standards guide that we just released. You will be able to see each app and how it ties to the CAPTE standards. Okay, so let me go to NeuroExam. Here are the CAPTE standards. For those of you who are working through your accreditation, who need to see this kind of content, we've made it very easy for you to see how each app is linked. That is, again, right here on that sidebar. The second thing you can do is when you click into any particular technique, so you say, hey, I'm teaching about oculomotor exam this week. I would like to link some of these videos in my PowerPoint. So you could go here to this sidebar, copy page title with link, go into my document here. Now, you could easily do this as, so let me make a PowerPoint, for example. You could easily put that link right here. So that's a little bit small. You can make it a little bit bigger, of course. So that, actually, I'm going to go right here so you can see it easier. Copy page title with link essentially puts the title of the technique, and it's already hyperlinked, which means that anytime you are running your lecture and you click on this link, it will open that video in PhysioU so you can demonstrate it right away. So the entire PhysioU video library is now at your fingertips. You can insert it into your lectures, or you can place it into your lab handouts, your current existing lab handouts. You can just augment your lab handouts. The other thing you can do here with this little sidebar is you can copy thumbnail image. So when I go into the lab handout or my lecture, I can throw the image in there. I think the image is very important. We went through every video and chose a moment in the video that would create a visual memory for the student. Because as they journey through the app, what they saw as an image in your lab handout is one level of exposure to the technique. You're associating words to images that make sense, to then videos that they have pre-watched before they come to class. And then when you open the app in class and talk to them about the different oculomotor exam, all of this is a very organized multiple exposure methodology of teaching students content that you're hoping they can organize in their mind, that they can give reasonable meaning to that cluster of techniques that you can then leverage when you're talking about patients. If you think about learning for our students, it's a lot of it is really about multiple exposures. I think one, multiple exposures. Two, the motor skills are developed over time, again, through multiple exposures. And then there's the application component. So what you just saw is the general gist of the NeuroExam app. Let me just slow down for a second and ask, does anyone have any thoughts, comments, or questions? Or is there anything that I could show you that you want to see in the NeuroExam app?
Nothing in the chat, Mike, but there might be two questions I can throw out there. One is, are there worksheets that if they were created would be very helpful for you folks? And number two, those who use this, do you have any kind of a pre-learning component where the students look at this stuff before they have a formal face-to-face or a virtual class session? So that way you kind of hit the track running. I know as an educator,
Right.
I've always worried about, try and teach more with less time, and if that can be more efficient use of the education time by using PhysioU.
Yeah, if any of you would unmute yourself, would you share a little bit of how you've used this in your classroom? Or any of the questions?
I can go. I'm
Great.
Mary, and I teach in a PTA program and teach the neuro component. And so what I do is I link the specific exams to my live classroom and let the students have that PowerPoint with the link there before we get to lab. So they've gotten some exposure to it. They can go back and look at that link. And then once we get to lab, we do use the videos so that they all are seeing the performance of the test once, and then we break up and then go ahead and practice it in the lab. So that's how I have been using it. I haven't utilized the handouts yet, but that's something I am trying to figure out how to incorporate.
Yeah.
And we don't have a whole lot of time to add more content. So I don't have any part of it as a prereq, but like I said, I do show some of it and link some of it in my live classroom sessions that we do have.
That's great. That's great, Mary. Thank you. To piggyback on that, Mary, I would just say you will be amazed at how powerful it can be that the students are given an order of an action order on how to prepare for lab. So for example, in my orthopedic lab, we have 50 to 100 techniques to cover in 4 or 5 hours. The students know before lab, they pull out the lab handout that I've created for them with all these links, and they watch all the techniques once before they come to class. This is the same thing several of my colleagues do in a number of different programs. And we have found that the students are much less anxious. They're much more ready to see nuances in the techniques. They're much more prepared to have discussions about when these techniques are used because it's not the first exposure. So I think one evolutionary step potentially for you is to, at the beginning of your neuro class, you say, guys, we have a lab handout that covers every single lab technique you're going to learn in neuro. And your job before you come to class is to look at all the NeuroExam tone techniques, tone examination techniques. Then we will talk about it and discuss it in class together. I think once you create that rhythm, you'll be amazed how the students actually appreciate that early exposure. What it also does, secretly, I'll tell you, over 8 years of using these apps, every time you invite the student, right, they click on a video, they wander into the app, they get used to the interface. What you're doing is you're helping them learn to fish with their own pole. The more they explore the app and the more times they see you navigate the app and find things. So you're like, hey, I have a patient. The patient may have a risk for falls. So I like to go and double check on a few of my key examination techniques, take a look at the equipment I need, what things I'm going to say, and here are my normative values. When they see the faculty member using that, it makes the student feel familiar with the resource, which means it will be in their pocket when they go out into the clinic. It will be in their pocket when they're in their third year class, where they're talking about multiple systems or the complex patient. All of this little bit of nuanced things that you do as a faculty member change the way that a student accesses this resource over time. And that was the dream. The dream of building this app was that they could, at any one moment, think about a cardiopulmonary patient, think about what neuro content neuro exam they need to do, look at some orthopedic tests that might be relevant. It's all in their pocket. And the more they see the faculty member using it, the more familiar they become with the resource. Other comments or questions about NeuroExam? And feel free to unmute yourself if you have thoughts.
The one thing, Mary, that it's hard to objectify, but and Dr. Wong kind of mentioned it here, that students feel more comfortable, that there's more permanent and sticky learning, when they see something first, and then, oh, I remember this tone, that's those flaccid patients with a stroke patient, if they're an aide or something. And then when you start doing it, they already have a context, like almost opened up a file for all that stuff to go into that might help them. Which I don't know if we can objectify. Still got to cover the X amount of stuff you got to cover, but I think it's a kind of a quality of learning for the students, a sticky learning. It sticks in their minds.
Yep. Any other comments? Okay, feel free to stop me at any point. I want to take you in to look at what these neuro simulations look like. So philosophically, I believe that after the basic didactic knowledge has been delivered and the students have begun to develop their motor skills, there is a half step. And that half step is, it's great to apply it to a patient type setting. So what you'll see is right now for neuro, we have a bunch of mini sims. Mini sims are patient-based scenarios. They're typically 5 to 10 minutes long, meaning it doesn't take much time. And their job is to take a sliver of a moment of an exam or treatment and bring that student into that clinical setting and allow them to apply some of the knowledge that they've learned. So let me just show you. Here are the mini sims that we have currently released. You will see that you'll be able to use different mini sims at different moments during your semester. So let's say you're doing balance that week. Timed up and go will be the mini sim. So I would go timed up and go. I would copy page title with link, put it into my syllabus or into my LMS. And the students just know, hey, on March 19th during the weekend, because we just did the balance module, my job is to go in and take this module. So when they click on this, they're logged into their PhysioU account, and faculty members have this special feature. So as our team was building this, I essentially said, you know what, faculty members always want to see what they are about to release into their classroom. They do not like surprises. So we created a course key. Let me walk you through the course key real quick. The course key is essentially slide by slide the entire game with the answers included. So learn to administer the timed up and go. interpret the findings, and demonstrate understanding of the above through a case scenario. So here is a 65-year-old male with Asia D spinal cord injury, and we think he has some fall risk. What test would you like to do? So they click on timed up and go. Now, as you click through the game, you'll see the different questions. How do you set it up? How should a patient begin the timed up and go test? Now, let me actually take you into the game for a second, because I think it's actually much cooler than just a PowerPoint slide. So I'm going to go through the game here. We'll skip the first few slides. We are going to do the timed up and go test. Correct. You're right. Now, another little secret. The students are looking for affirmation of their knowledge, or they're looking to learn from their mistakes in low stakes environments. So to me, these are loose quizzes. I'm happy if they do it as many times as they want until they get their 100%, because ultimately the learning would have occurred. I don't use this as a one-time game and whatever they get is the score that they're going to get. I'm happy for them to play it as much as they want. So I'm going to go here, 3-meter path with a chair and a marker. Let's see. Yep. Submit. All of these little corrects make students happy. And that's how you get them to engage. How should a patient begin the timed up and go test? Seated with a back against a chair. Great job. When do we start it? Well, time is started. Let's see. Once the patient's back leaves the back of the chair. Let's choose that. Now, let's do it. Okay, so we're going to watch the video. So time how long your patient takes on the time up and go test. Click on the image below to play the video.
All right, so what you're going to do is when I say ready, set, go, you're going to stand up using the walker. You're going to come around this yellow piece, the blue piece of tape. You're going to turn around that tape, come back to the chair and take a seat. Okay. All right. So ready, set, go.
I just started the timer on the stopwatch. When the time is done, when the patient is back at their seat, they hit stop. And then we ask them, what did you get? How long did it take to complete the tug? So they can choose. If they timed it right, they should get 1 minute and 12 seconds. Good job. Now, please interpret. Based on this time, what recommendation would you give him? If the students at this point can't quite remember, they can view the hint. And so now they're like, you know what? This patient should use assistance when ambulating in the community. We also ask the students in this particular game, they can watch the video again. What are some movement faults that this patient might demonstrate? Well, I think he has some decreased dorsiflexion, decreased hip extension. We'll watch that just for a second again. Okay, so decreased step length, a little bit of vaulting. All right, perfect. Then what would you like to do if that's the case? We purposely built these answers to not be that difficult, not that challenging. Well, I think we're going to work on improving mobility. I'm going to passively stretch the hip flexors. Boom, and the game is over. Now, the students could retry it if they're not happy with their score. They can go back and review what they got wrong. So I'm going to go here and review what I got wrong so they can see the things they got right and wrong. And when they're done, we have the students turn in their learning report. So this is what I just did with you. 3 minutes, 58 seconds of enjoyable interactive learning. They download their learning report. It gives you the most recent 5 attempts and the highest score that they scored. It's low stakes interactive learning, all created for you so that you don't have to create these, and we can create meaningful clinical context for students to apply the knowledge. So the students just turn this into a little Dropbox, and then we eventually give them very, very minor points. So it's, you know, it's like raising a little, it's enticing students to engage with the material from different perspectives, different ways. The students have reported they really enjoy seeing how these things are applied on real patients. So that's just a glimpse of how we use the interactive learning, the mini sims here. So you have a number of these different games. In fact, we're just recently, Mary, myself, and Kristen have been going through all of them, vetting them again. We got some great feedback from faculty. So as you're using them, feel free to also give us feedback, and we go in and we modify and we make them better and better. So these are all easy to use, easy to deploy. Remember, you can deploy it just by copy the page title with link, put it right into that week. And you're like, guys, you need to do, you know, interactive learning. And they just click on it, they take it, they submit it. So now you have this as an option. Just as a sneak peek, I want you to know that we have a number of MacroSims. Speaking of Sarah, of course, Sarah and I and one of her ex-students have been building some very extensive clinical reasoning development neuro games. So this will have the full patient history, basic concepts about side effects of medications and how they may impact physical therapy treatment, analyzing data from outcome measures, develop a 1-hour treatment plan. And it starts really from watching the patient tell their story. And when you're done watching the patient tell their story.
Perfect. So hi, I'm Sarah. Can you tell me what your name is?
My name is Patricia Chase.
Okay. And Patricia, can you tell me why you're here in therapy?
I had a stroke on May 6, 2013.
Okay.
Was
And-
found on my floor.
How long were you on your floor? Do you
They
know?
don't know how long I've been down there.
Eventually you come to the different components and you get to read a little bit about each part. So building these games is a lot about how to organize lots of information. I will have a special session when these sims are ready to be released, these macro sims. These ones will probably take closer to 30 to 45 minutes, but there's a lot more clinical reasoning development. So that's why you see PhysioU's created micro sims, short, quick, patient-centered, and then these macro sims, which are much longer, but your ability to tease out clinical reasoning and decision-making is much bigger. And so I think there's a place for different types of simulations. When that time comes, when we're ready to release this, I will hold a special session so that we can walk through all of this together. So this one is not available yet, but there are a number of these that Sarah, myself, and Connor were working on. Any comments about those real quick, about the e-learning, the micro sims or mini sims and the macro sims?
Chat's clear.
Good. Okay. Let me show you a sneak peek at one of our most recent apps. This ties in very nicely to the NeuroExam. When you go into the task analysis app, what we did was we went into the homes of a number of these patients, many who come for our patient days, except that we couldn't have patient days last year. And we're not sure we're having them this year. We decided to film all of the common activities that they do in their daily life. So in the learning phase of the task analysis app, you see that we have taken the two leaders the two leaders in the PT world related to task and movement analysis. And we essentially filmed some samples, right? So for example, here's sit to stand. Here is the front video. Here is the side video. And here is the video simultaneously. Okay. We've also broken it up into initiation, execution, and termination. So you just see these moments. Here's execution. And here's initiation. We've also, so Mary went through and helped us do the full analysis. So it's all written. This is the learn phase. The students will use this to model after. Here's the analysis. Here's the initiation. And here is the movement system diagnosis. And here is how Mary would have documented this whole thing in a SOAP note. Now, if you go to Headman movement analysis, you'll see that there's a number of different tasks. So let's take toileting, for example. You can watch the whole task. You can read about the initial condition, preparation, initiation, execution, termination. So all of this has been analyzed already. And then how it is documented. So the learn phase is basically how students model after the expert on some common movements or tasks. So that's Headman. You have all of these different videos. The next thing you'll see is you can move on to practice. In practice, we have the entire sheet's task analysis, all the items, all the different tests that she would do. But this time, it's time for the students to go through and complete the worksheet below. So here's the worksheet. I can make that a little bit bigger here. And it's time for them to go through the process.
All right, so now what you're gonna do is you're gonna step up and touch the top of the steps. You don't have to step onto it, just touch the top with the right foot, then your left foot, right foot, and then your left foot, or left, right, left, right.
Okay.
Okay, ready, set, and begin when you're ready.
Okay.
Good. Good.
So you can see that all of these different tasks have been filmed, ready for you to create an interactive classroom for your students. This is an activity you do in class together. They have the worksheet to fill out. Or this is an assignment for them to do at home and to turn in that worksheet or bring it up to the front of the class for discussion. If you go into Headman movement analysis, you can see that we have filmed typical female, typical male, patient with COPD, right total hip arthroplasty, CVA right-sided hemiparesis, C5 spinal cord injury. So let me just give you an example. If you go here and you look at dressing, you have the opportunity to see him go through in his own environment, how he would go about dressing himself. So I'm going to take you forward a little bit here. So that's the close view. You have the opportunity to go wide view as well. So let's choose a moment here in the video. And then you can click and directly compare to typical. So you have close view, wide view, compared to typical. That includes everything from dressing, grooming, financial management. So let's go ahead and count cash and count the coin. You can look from the front. You can look from the top. Essentially, each day that we would go into the homes of one of these patients, we would spend almost a full day doing everything from dressing, toileting, gardening, getting in and out of a car, going out to the mailbox, mowing the lawn. We essentially captured almost every task that they do in their daily living. And then you have compared to typical. Finally, you can move into the case studies. The case studies, basically what we did was we took these different patients and we gave you a brief history. So these are, again, things that can create interaction in your classroom. Here is her story. And we handpicked a number of different tasks, getting inside the car, getting out from the outside of the car, so that students could then do their analysis based on the case studies. So we handpicked the most common activities that we thought were relevant to this patient, instead of giving you just a library of 150 videos, which is generally there under practice. You have a library of all the tasks that these patients did in their home. For the case studies, we handpicked a bunch of very relevant functional tasks for you to look at. So there's John mowing his lawn. And the student's worksheet to do their analysis. All of this is now at your fingertips. We bring the patient into the classroom for you. So let me take a pause here and ask for any of your thoughts, your comments, any questions. Any thoughts or comments? I'm also
there's
Yeah.
a question about the speed of the video. It's almost probably like, you know, how you're analyzing gait and you can slow it down to see it. I was wondering, so a question in the chat was asked if they can be played at different speeds.
Let me just check. You have speed normal. You have that option here. So you can move it faster or slower. I mean, oftentimes the speed is relatively slow as it is, but you have that option here. So I hope that helps. Other thoughts? Feel free to unmute yourself if you have, yes, let me see. Someone, oh, Lewis. Please go ahead and unmute yourself and
Ask away.
Ask away.
Hello, good evening.
Hi, Lewis.
Hi, how are you?
Great.
I just want to appreciate you for bringing this up. I'm in Kenya, and basically this is something that is going to raise or improve onto our teaching skills, knowledge, resources, and probably just to request that you kind of maybe we have some more time to just guide us through how to still use the app, because I've just been following up and I think we still have a long way to go in terms of getting to know how to navigate every aspect of the app. But generally, it's a good thing that will really improve our teaching experience as well.
Wonderful. We're so happy to support education worldwide. You know, part of my dream is one, to have these translated into the key languages, some key languages, as well as to try to homogenize how we teach techniques and tests. If we can have a uniform resource, it makes our profession stronger. The other thing I would say related to your comment is that if you go, and I'll put this link in the chat, if you go to our main website, so let me go here.
You're going to reference the hotspot appointment
Well,
thing?
I'm going to reference in the faculty resources.
Okay.
There is a number of different webinars on demand. You can learn about pretty much any one of our apps based on re-watching some of these demos. That's one way to do it. So I'll put this in the chat. And the other way to do it, so let me see, everyone, here is one way. The other way to explore the apps, basically what I've done is if you go under Educator, Physical Therapy Faculty, you will see that I have sorted the apps by the different content areas. So when you go into, let's say, musculoskeletal rehab, you will see that I have made a short video tour of how we use the apps in the classroom. So you can learn about any one of the apps and see what's in there, get ideas on how to use it. So I will go back to the main physical therapy faculty page, put that again in the chat. Let me open the chat here. Those are some options. And it's always a great option just to join us when we are having these webinars. So when you go again, the same way you got access to this webinar, if you go to the faculty resources, you will see that we will be running every Friday for probably my foreseeable lifetime, because I truly believe that we can bring in a new generation of teaching and learning, that faculty members can now rely on faculty built resources that are always up to date. We are constantly filming in our studio and listening to feedback and dreaming on the cutting edge of what does it mean to help a student become a clinician. And it is far more than just having a library of videos. That's why you are seeing all of these e-learning content. This was all done in 1 year. Games for almost every area. I mean, some of our wound care simulations that are coming are just amazing. We went and filmed and there will be clinical reasoning development related to wound care. So other comments, other questions?
There's a question in the chat asking if this webinar is being recorded.
Yes, this webinar is being recorded and it will be sent to all of you so that you could also share it with your colleagues. So there will be a link. And by the way, that same link that I sent you in the chat, which is here, webinar on demand, it is always posted here. So we just keep posting last week's webinar, so you can keep watching. So it will be here probably in a week, and you will also get an email with a link to that webinar.
I have a comment for Lewis and all you folks. I mean, I think there's, my brother asked me this morning, Mike, he goes, are you ever going to get finished with your apps? I go, nope, we're going to continue to upgrade and update education for these folks, you know, as just to continue to improve the education that these students receive. You know, faculty resources that Dr. Wong showed you, these webinars are a good way, Luis, and the rest of you folks, just to continually see what's going on. And we enjoy these faculty webinars because Mike and I and the team can't think of every question you guys may have. And that's why Mike doesn't rhetorically ask, are there any questions or input? You know, it's really an invite to give us your feedback in terms of, hey, maybe doing this be better. fellow faculty members, if you have another colleague who's using PhysioU and they figure out some tricks they learned, I mean, that's another resource. And I hate to tell you, but the students, if they're using it, they go, oh, Dr. Wong, did you know blah, 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 blah. And so that'd be helpful. And lastly, I put in the chat a link to, and Louis, if you have specific questions in a specific class, maybe you want to see how best to use PhysioU, you can always schedule an appointment with Mike. We call it a virtual coffee with him, and he can actually walk through, even specific stuff for the individual teacher and their program. And we have this class before range of motion, we have it afterwards. So how best to, massage the information in PhysioU's suites to work for you guys. So.
If I were to just give you in summary how you could use these in three main thoughts. One is every single NeuroExam technique you teach, you have a video now to help students pre-learn before lab. So just think about, where can I put this? Can I put this in my lecture so that when I'm talking about techniques, they can see it? It can create an imprint into their brain. That's the first thing. I can now show videos of almost anything I'm going to teach in neuro. I can show videos in my PowerPoints. Now, remember, right now, you can only put links. You can only put links into your PowerPoint. And when you click on the link, it will open up just like this, and you can play the video. So it is almost as good as putting it in your PowerPoint itself. So you now can augment all of your lectures with these hyperlinks and pictures. Remember how you can copy this picture by using this little copy thumbnail image? Your lectures and lab handouts are about to become amazing. Secondly, there are lab handouts that we have created for you. Those lab handouts are available for you to augment, to take over, to reduce your workload. They're all there, and they match the videos and the content that's already in the app. It's all done for you. So that would be the second thing is having the students pre-watch videos before they come to lab. I think it is a revolutionary way to help students learn motor skills, multiple exposures. And a secret half tip, don't miss a chance every day in class to open the PhysioU app and to show them, okay, guys, we're going to go into the NeuroExam app today. You see, they're learning. That's what the students are doing. They're watching you. They're modeling after you. I have a patient that I'm worried about fall risk. I'm going to look in the balance section, take a look at my different tests. And you should recognize some of these tests that you've already watched. Let's talk about them. Let's go practice them. Take your iPads, your phones, everybody go practice. All these videos are at the students' fingertips, and they learn to use it better when you use it in front of them. This is a very critical component. And then the last piece I would say is students yearn to apply this material in a low stakes setting. So really try to leverage these e-learning components. All you have to do is go in, look at a mini sim, glance at the key, take a look at what's in the game, right? Take a look at what's in the game, feel comfortable with that, and then assign it. Let them do it. You could do it in class, last 10 minutes of class, everybody go ahead and play the game, turn in your learning report, right? And eventually we're going to have 3 to 4 MacroSims. These big ones you intersperse throughout the semester. Typically you use it after they have learned the material related to management of stroke, management of a stroke patient, or management of a traumatic brain injury patient. You allow them to play through that game so that they can begin to apply their knowledge in a relatively safe, low risk environment. These 3 things will transform your classroom and will transform the way the students learn material, develop motor skill, and learn to apply their clinical reasoning. So those are my top 3 things of how you could leverage this into your classroom. Any comments or questions? things that I can show you? Any other comments or questions? Things that you might need actually, or ideas that have come up in your mind about how you might use these. Any thoughts? I hope that's been useful for you. Please feel free, if you ever would like just to chat and learn a bit more, or tell me a little bit about how you're teaching it, and ask about how you could integrate these apps, please feel free to book a meeting with me. I think James has put my meeting link in the chat. And you'll also know that next week, next Friday, I'll be talking about Sarah's app, so neuromuscular rehab, and the PNF app, understanding full well that PNF is not well evidence-based. In my conversation with a number of faculty members, they said, you know, Mike, it would be such a shame to completely eliminate that. There are so many elements of hand positioning, of movement, that are useful in some form, as long as we qualify that this particular methodology, philosophy of treatment has not had strong evidence behind it. My colleagues and some of my alumni who now teach at Kaiser Vallejo, they are working on research. And in many cases, I think this can be parts of PNF, or elements of it could perhaps be utilized in your classroom. So I'll give you a glimpse of the NeuroRehab app, as well as the PNF app. All of that will be happening next Friday, 9 a.m. Any comments or questions? All right, thank you everybody for joining us. I hope you have a great weekend, and look forward to hearing all your stories of how you've integrated PhysioU into your classroom. I hope this has been useful for you, and I'm excited always to connect with you, hear your ideas. There's a lot of cool stuff coming. There's a lot of cool stuff coming. We're working hard, and we thank you for your support and your feedback. We're working really hard to try to elevate learning in the world. So thank you, everybody, and have a great afternoon.